What should I expect from a first-time nose surgery? Number one, you need to expect to be very, very patient. It's going to take a full year for your nose to heal. 80% of your swelling is going to come out in the first 8 weeks, and that last 20%, mostly focused to the bottom third of the nose, is going to take 10 more months to go away. If you have any kind of work done on the inside of the nose, especially for airway reconstruction, it'll take 3 to 6 months before that normalizes. So you're going to need to make sure that you're helping that intranasal component heal as much as you're working on the outside cosmetics to look good and heal properly. So in my practice, essentially, I have patients back to cardio at 2 weeks. They're back to weightlifting at 4 weeks, and then they can go back to any kind of contact sport and the use of things like eyeglasses, sunglasses, and in Colorado, ski goggles. They can do that at 2 months. By that point, any of the nasal bone work that I've done to narrow the nasal bones and maybe reduce the hump or straighten the pyramid or a combination of all the above, at about 2 months, those bones have sealed in enough and healed up that you're going to be good. So at that point, you can put some pressure on the nose more, etc., and you can be comfortable in the fact that you're probably not going to do any damage. That's not always the case with the lower part of the nose. You do need to be careful with the lower part of the nose a little bit longer while those sutures inside are healing and the tissues are scarring in and settling in. In that time period, small things can happen, and so we're going to guide that along with nighttime taping for the first 2 months. We're going to talk about 3 times a day soft tissue massage. I've got a great YouTube video about that. And we're going to guide you through the healing process. At the end of 1 year, 94% of my patients have exactly what they need. A small percentage come back after the first year and say, Dr. Shaw, can you tweak this? Like, my scar needs a little bit of work. Or, at about 4 months, my hump was nice and flat and gone, but I feel like I have a tiny return of the hump. So we'll come back and do a little rasping under local anesthetic. It doesn't matter. Whatever it is, you let me know and I'll make sure we work on it if we need to. But like I said, 6+% of patients will come back for a minor touch-up. And that's just included in your care with us. And so if you have any questions, let me know.